OK, we're going to see what the Minister for Primary Care and Public Health now has to say. That's Neil O'Brien. As we say, good morning to him. And Neil, the whole thing today is about the government's primary care plan, expanding the role of pharmacies. Tell us what you have in mind.
Yeah, so what we're doing is we're going to free up lots more GP appointments, about 15 million appointments a year, by enabling people to get treatment at their pharmacist that you would have to go to a GP for today. So if you've got a really sore throat or earache or a rash or something like that, you'll be able to go to a pharmacist, get quick treatment, and they'll be able to prescribe antibiotics as well. And so as well as being a really convenient way of getting the healthcare that you need, it'll also free up GP appointments, so it's also easier to see your GP. And so we're going to spend about £645 million on that. Oh, sorry, carry on.
Well, I was just going to say, if people can find their local pharmacy, I mean, the numbers of pharmacies are down to their 2015 levels, and we understand from one of their associations that there is a funding shortfall of £1.1 billion, which isn't even going to be touching the sides with this investment from the government.
So there are more pharmacies than there were when we came to office, and this investment that we're making today of another 645 million is exactly responding to those pressures, and it's responding to something that a lot of pharmacists have said to me, which is that they want to do more. They want to do more proper clinical work and advanced services, and by making this big investment today, we're going to enable just that, and so that will take some of the pressure off pharmacies as well as taking pressure off GPs. But the other thing that we're doing today is making another big investment, about £240 million in new technology for GPs, because we know it's so frustrating for people and really terrible if you ring your GP and you can't get through. And that's why we're spending the equivalent of about £60,000 per practice on new technology, so that we upgrade their phones and you never get an engaged tone again, and that we also give them really good online access, partly to free up the phones and partly because that's a really convenient way of getting in touch with your GP as well for a lot of people. So as well as the big investment in pharmacy to take the pressure off, we're also investing in technology and also going to carry on growing the number of appointments and growing the workforce as well. In the last budget, we took action to improve GP pensions. That was the number one thing that GPs had been asking me for. That will help to retain more really senior GPs. We're also going to continue to expand the training of GPs as well, because we've taken the number in training every year up from about 2,600 a year to 4,000. But now in our forthcoming workforce plan, we'll be able to go further. And we'll also, as well as more GPs, we're also going to invest a lot in the other workforce in general practice, because it's not GPs on their own, of course. There are the nurses there and all the other clinicians. And we've now got 25,000 more of them than we had even in 2019 before the pandemic. In fact, in total, it's about a quarter more people working in our general practices than there were there. And they're doing about 10% more appointments every month, which is an amazing achievement. I really do pay tribute to our really hardworking GPs for everything they're doing at the moment.
Forgive my naivety, why wouldn't we just have 25,000 more doctors, more GPs?
Yeah, well, we do have more GPs. We have nearly 2,000 more GPs than we did in 2019, and we are increasing training numbers and also taking those big measures like the pensions reform to ensure that we retain the really good experienced GPs as well. So we are growing the number of GPs as well as the number of those other clinicians like the physiotherapists and the pharmacists and so on. And we will continue to go further, and that's what we'll be doing in the workforce plan, the first ever NHS workforce plan, coming shortly.
I mean, Mr. O'Brien, you'll forgive our scepticism. I mean, Eamon and I have both covered similar stories like this almost every year since the time immemorial. Just last summer, your boss, Steve Barclay, said he was going to make these changes. Then his successor, Therese Coffey, under Liz Truss, promised she would overhaul GPs and get rid of the 8 a.m. scramble. And now Steve Barclay's back in post and he's promising it again. This smacks a little bit of after the bank holiday weekend and the terrible local election results, sort of back of the envelope press release.
Well, there's nothing back of the envelope, but this is the first time we've ever enabled these services to be delivered in pharmacy with new money, £645 million of new money to enable a completely new NHS service that no one's had before. So it's a very new thing. The technology investment is new, and that investment in growing the workforce and getting more appointments, that's new too. So all of this is a really substantial plan. It's not the end of the story, of course, and we'll be going further, but it really is a big investment to enable more pharmacy work, more GP work, and that's why a lot of pharmacy groups, and indeed the Royal College of GPs, have welcomed it as a positive step forward.
And Minister, when as a patient would we be seeing a difference? How soon would we notice that our calls are being answered quicker, that there are more appointments available?
So in terms of being able to go to your pharmacy and getting these new services, that will be coming later this year. In terms of the new technology that we're going to be giving to GPs, that's going to be rolling out during the course of this year and into next. And in terms of the extra staff, well, some of them are already there. There's already about a quarter more people working in GPs than in 2019. But that will be steadily growing over the coming months and years. So it comes in a kind of phased way, and we will of course be doing a big communications campaign so that people will know when these services are becoming available in their area.
Just lastly, I want to ask you about the backlash about some of the policing over the Coronation weekend. The Prime Minister has said he's grateful for the efforts of the Metropolitan Police, and yet the police themselves have overnight expressed regret for what's been described as heavy-handedness. Which way is it? How do you view their policing?
Well, I think the police did a really excellent job over the Coronation, enabling a fantastic, joyous national event to take place without incident, stopping people who wanted to do silly and irresponsible things like setting off rape alarms from disrupting events. So I think that they did a good job over the weekend. Obviously, it's obviously regrettable if anybody gets themselves arrested on what should be a really good occasion for the nation. But I think the police did a good job overall, and overall enabled a really great and impressive event that the entire nation enjoyed. So I think they did a good job.
Sorry, just to pick up on the point about rape alarms. I mean, that was a Home Office approved charity that was handing out those rape alarms. There were a huge number of women travelling in the cover of darkness to get to the Coronation. I think of my own mother-in-law, nearly 60 years old, on a night bus going up to the Mall. People were trying to look out for women and protection, and people were arrested for trying to help in that scenario. Do we really want to live in a country where somebody who's anti-monarchy, we may disagree with their views, but are arrested just because of the title of their job?
It wasn't about that. The threat was that people were going to deliberately let off rape alarms in order to scare horses and disrupt that procession. That could have been a tremendously dangerous thing to do. If you startle a load of horses, people could have been trampled, and as well as being disruptive, it could have been a really dangerous, stupid thing to do. So I think that the police did the right thing in keeping order, in enforcing generally decent behaviour. So I think that they've done the right thing, and that in a difficult scenario, they always have to take tough decisions. It's not for me to second guess every single decision they make, but overall I think they did a good job.
Minister, got to leave it there. Thank you very much indeed. That's Neil O'Brien on the government's primary care recovery plan.